So good morning, everyone, and welcome to this really important information session on the Volunteer Support Services Program. My name is Kirsty Blades and I am the CEO of Palliative Care New South Wales, and I'll be facilitating today's session for you. The key speaker today will be Kate Bowman, who's the manager of the program, who I will introduce to you shortly also. But I would like to start by acknowledging that I am hosting this session from the lands of the Cammeraygal people, and I acknowledge their connection to land, waters, and the community. And I think it's really important to acknowledge that community is such an important connection when we talk about palliative care and our Aboriginal and Torres Strait Islander brothers and sisters. I pay my respect to their elders, past and present, and extend that respect to all Aboriginal or Torres Strait Islander people who are joining this webinar today. I would also like to acknowledge that the Volunteer Support Services Program is funded by the New South Wales Ministry of Health. So that funding is incredibly important to us to continue to offer this program. So we do thank the Ministry for that support. It would be great if you could pop into the chat the land that you're joining this session from today, and also perhaps your job title and your organisation name. It could be volunteer if you're joining as a volunteer, or your particular title, just so that we can see who is online and who is joining us today. So if you could please pop that in to the chat, that would be really fantastic. We'll also be using the chat functionality to ask our questions today. So as Kate is presenting, if there are questions that are popping up in your mind, then please do pop them into the chat box, and then we'll collate those. And we have left quite a lot of time for questions as part of this session. That was really a key goal that we did. We were able to do that. So I just wanted to talk about the reason we are also running this session today. First of all, this was one of the things that was spoken about and was quite popular for people who were at the Oceanic Palliative Care Conference in Sydney. Kate was busy managing the volunteers during that event, so didn't get a chance to really have an in-depth chat to people about the program. So this is a great opportunity to have that discussion now, since we weren't able to have that discussion at that conference. The other reason we have chosen to run this session today is actually in recognition that this Saturday is World Hospice and Palliative Care Day. And this is a really important day for us to recognise. The theme this year is Compassionate Communities, Together for Palliative Care. And volunteer programs such as this are such an important part of a compassionate community. So running this session in the lead up to the day on Saturday is something that we felt was also important to do in recognition of that day. We have been posting on our social media accounts this week, and we'll continue to do that for the next couple of days. So you might like to share those posts and share the message around the importance of community when it comes to palliative care, and that ultimately that palliative care is everyone's business. So it now gives me great pleasure to introduce to you Kate Bowman. And Kate considers herself a pathological volunteer who has contributed many years and many hours of life pitching in and helping. So she's a perfect person to be leading this discussion, but also the program at Palliative Care New South Wales. Kate spent 9 years as a volunteer coordinator for primary ethics, and then had a penchant for research and social justice, which led her to complete a Bachelor of Social Science with a major in sociology at Macquarie University. Kate has contributed to several research reports on palliative care volunteering since she joined Palliative Care New South Wales in 2016. And she's now delighted to champion volunteering personally as manager of this important program. So I'm going to hand over to you, Kate.
Hello, everyone. Thank you, Kirsty, for your introduction. I would also like to pay my respects and acknowledge I am working here today on Gadigal country. All right, so let's get into it. What is this Volunteer Support Services program all about? Well, 10 years ago, the New South Wales government had a plan. The New South Wales government plan to increase palliative care 2012 to 2016. This plan identified volunteer activities as an integral component of care networks for people who are dying. The government acknowledged that palliative care volunteers provide very important care, not just for patients, but also for their families and carers. They knew that with this extra care, which may take the form of companionship, practical assistance, provision of respite for carers, and other supports, it becomes more feasible for a person to receive care and die at home. The government knew there were some local health districts already with some volunteer programs in place, but that was about all that was known. No one knew exactly who was running the services, how many volunteers there were, where they were, what the scope of their roles was, how people were referred. There was no big picture. Enter Palliative Care New South Wales, who received funding for the Volunteer Support Services program in 2014, charged with bringing to life a vision to make volunteers a consistent and prominent feature of specialist palliative care services. The first task we did was research. We gathered data and mapped the New South Wales palliative care volunteer landscape, from Mullumbimby to Broken Hill, down to Albury and everywhere in between. This research gave us a baseline to work from. Now we had a list of all the palliative care volunteer services. We knew what regions had coverage and where there were gaps. And now I could really get to work. And do what exactly? Well, a lot more research for starters. Since 2014, we have published 18 research reports, plus 5 books and training manuals. In 2017, we published the statewide framework for palliative care volunteering, which offers a set of practical yardsticks, measures, and goals to support the success of palliative care volunteering in New South Wales, including recommendations relating to governance and management strategies, recommendations relating to the performance of the role of volunteer managers, performance measurements and reporting guidelines, volunteering and community engagement, and goals of and approaches to training for palliative care volunteers. We continue to map the palliative care volunteer landscape every 4 years. Our most recent research, the Snapshot 2022, a review of palliative care volunteering in New South Wales, was published just a couple months ago. All our publications are available to download free on our Volunteer Hub website. We now know a lot about palliative care volunteering, about service delivery more broadly, and the challenges of operating in rural and regional areas. We've carefully grown and curated this body of knowledge for almost a decade. Ultimately, our aim is to increase the capacity of palliative care volunteering in New South Wales. This collected wisdom provides the framework from which we bolster existing volunteer services and can help foster the growth of new ones. Right, before I get into how we actually do all this fabulous supporty stuff and what's in it for you potentially, I'll give you some fun stats and info on palliative care volunteering in New South Wales. At its peak, pre-COVID, we had over 1,600 volunteers spread across 44 palliative care volunteer services. There were services operating in every health district. COVID had a huge impact, with many services experiencing lengthy breaks in service, with some closing down permanently, sadly. Based on data gathered from our most recent snapshot research, active volunteers dropped to as low as only 748. That's 2021 data. But luckily, overall things are bouncing back well, thank goodness, and we have more research planned for early next year to track the recovery. So at the moment, there are 43 services operating in New South Wales, 11 within the Sydney metro area, 32 based in regional areas. And while most palliative care volunteer services are run by local health districts, about a third of them are operated by NGOs or other types of community groups, and some are entirely run by volunteers. Services may have their volunteers active in inpatient settings such as palliative care units, or they may offer community visiting where volunteers will visit clients in their home. Most services do both. Only a few services currently have volunteers visiting in residential aged care facilities. This is a potential growth area for services looking to expand. Paediatric services also have volunteers Bear Cottage, the Children's Hospice and Respite Unit in Manly, thrives on volunteers, and the Sydney Children's Hospital Network coordinates family support into homes all across Sydney and even across New South Wales from their hospitals in Westmead and Randwick. There's also a volunteer service operating in the brand spanking new adolescent and young adult hospice, which opened earlier this year. So what do volunteers do? What they do changes slightly depending on the setting, but mainly they're valued for psychosocial support. It's pretty simple, having someone there to talk to. Community visiting volunteers typically visit the same client every week and build rapport over many months. Companionship. You can't underestimate the power of human connection and just being there with someone. Volunteers engage clients in social activities. They might go for coffee or to the beach or play some cards or do some craft. Grief and bereavement support is also important, both before and after death. We know there's a lot of anticipatory grief that goes along with a life-limiting diagnosis, which volunteer support can help manage. Volunteers have a role to play providing follow-up support for families after death, writing bereavement cards, attending memorials, making phone calls to check in. Volunteers also support the family and carers along their journey. They might help kids with homework or give a frazzled carer a listening ear. Carer respite is just as important as psychosocial support. Anyone who's done any caring knows how exhausting it can be. A volunteer might give the carer space to have a nap, take a shower, go for a haircut, and just not worry that their loved one is left alone for an hour or so. Palliative care biography is becoming more and more popular. These volunteers are specially trained to create like a life story document with photos and stories and meaning. For the client, this is a powerful dignity therapy, and the family are left with a legacy document to cherish. Other volunteer activities might be looking after special equipment hire. They might do transport to medical appointments, especially in regional areas. They might do some fundraising. They might be doing admin or putting on community awareness events. Palliative care volunteers undergo extensive training to equip them with the skills needed to provide these kinds of supports well. It's not for everyone, but I hear from volunteers all the time who tell me how life-affirming and meaningful they find their role and how they can tell they really make a difference to the lives of clients. Obviously, clinical support is important, but nurses, especially community nurses, and especially in rural areas, are super busy. Often it is the volunteer who has that extra time to give. They hold the space, and they're a big part of that holistic, person-centered care that we hear so much about. So who do we support and how? As Kirsty said, we're funded by New South Wales Health to champion palliative care volunteering. Who needs us the most? Most of our supports are directed towards volunteer managers and, by extension, their volunteers. New managers get extra support as required. We do our best to ensure rural and regional areas get as much love as the big city services do. Rural and regional areas are more likely to be governed by NGOs or community-based groups, which typically have less resources available to them than the bigger LHD-run services. So we try to fill that gap in whatever ways we can. We're also available to support organisations who are looking to introduce a new service or expand an existing one. We've championed several projects and worked with a variety of stakeholders, including local health districts, primary health networks, community service organisations, and local people, helping to establish volunteer services in Western Sydney, Western New South Wales, Southern New South Wales, and in the Hunter. So how do we do all this? What have we got to offer? Our website hosts all our information and resources. That's the volunteerhub.com.au. As previously mentioned, thanks to our research, we hold a significant body of knowledge on palliative care volunteer service in New South Wales. After nearly 10 years in the biz, we have the expertise. We provide information about palliative care volunteering to government, communities, service providers, clinicians, healthcare workers, aged care facilities, volunteers, potential volunteers, and volunteer managers. as well as the general public. Anyone who's interested, basically. All our stuff is on our website for the world to see. If there's something we don't know, we likely know someone who does and can point you in the right direction. We've developed a suite of resources which support volunteer service providers, including documents on policy and procedures, service guidelines, templates. We've designed them to be customizable for different settings and governance models, and they're super useful when setting up new services or when updating old procedures. We have a set of resources just for volunteer managers new to their role, who might not be so familiar with palliative care volunteering. We actively engage with these new managers, providing one-on-one help and guidance as needed and connect them with their peers. Our most popular publications are our volunteer training resources. The Palliative Handbook is a comprehensive training book for volunteers. It works in tandem with our training guidance manual, assisting educators to deliver the learning modules found in the handbook. Many services use these materials when training their new recruits or as a supplementary resource. We keep our eye on what's happening in the sector, sharing news and events with our networks and subscribers. Several times a year, we host forums for the ongoing professional development of volunteers and volunteer managers. Every second year, we hold a big volunteer conference. Volunteers travel from all over New South Wales to attend, and they love catching up with their peers and swapping stories. The conference is a big deal. It's actually on week after next, and we're all looking forward to it. In the alternate year, we have a volunteer manager conference, which provides a great opportunity for professional development and networking. We work closely with the New South Wales Network of Managers of Palliative Care Volunteer Services, which meets quarterly. The network provides members with opportunities for peer support and mentoring. They are a huge brains trust. They've got a wealth of knowledge between them. Some managers have been in their role a long time and pretty much know all there is about wrangling volunteers and service executives. If you are a volunteer manager and you come across a problem, you can pretty much guarantee that other volunteer managers have come across the same problem before, and they're always happy to share potential solutions or at the very least commiserations. I spend a lot of time maintaining connections with volunteer managers from existing services, but we're also here to support new service development and help with expansion of services. I collaborate and consult with LHDs, NGOs, and other parties, especially in rural and regional areas, helping in whatever ways I can to build capacity in the sector. I feel confident that if you are thinking of setting up a service, we have something to offer you, and it's not just impersonal PDFs on a website. I'm always happy to chat. Hopefully some of you joined us today because you're interested in setting up a palliative care volunteer service of your own. Successful and effective volunteer programs do not just happen, but where there is a will, there is a way. Most obviously, you must have buy-in from your executives. Without executive support, a service will flounder. And I'd just like to touch on the 3 things I believe are necessary for volunteer service success. Number 1, a good volunteer manager is essential. They will be the cog that keeps the whole operation running smoothly. The role of a volunteer manager is often misunderstood and therefore undervalued. They are the all-important liaison between clinicians, volunteers, and clients. Clinicians must feel confident to send referrals their way. Volunteers need to feel like they're being well utilised and an important part of the team, and clients need to feel they are being well cared for. A volunteer manager's role is diverse. They recruit, train, and administer volunteers. This is a short sentence which belies the amount of time and effort that all takes. They match suitable volunteers to compatible clients. They maintain volunteer rosters, juggle the expectations of their executives. They are there to debrief volunteers, keep up team morale, make sure everyone's engaging in self-care, maintain databases, check everyone's upholding professional boundaries and has up-to-date vaccinations. Often they have additional tasks, fundraising, holding community events, sending out newsletters. The list goes on. It's a lot. They are amazing. Volunteer management is a profession unto itself. Often executives expect this role to be taken on by nurses or maybe social workers as an adjunct to their main role. I don't want to give you the impression that they can't do the job well, as many as our network do exactly that. However, I think a dedicated volunteer manager will give your service the best chance of success and not risk volunteering tasks being deprioritized by a sudden increase in clinical workload. A competent and focused volunteer leader should run a service best. Secondly, we need to think about referrals. Without referrals, a volunteer service cannot function. Referrals most often come from the local specialist palliative care nurses and clinicians, but also may come from local GPs or aged care facilities, community nurses, and some places even accept self-referrals. The people making the referrals need to trust that the volunteers are up to the task. They're sending strangers into vulnerable people's homes after all. Adequate training for volunteers is vital to ensure boundaries are not crossed and relationships are professional in nature. It's important to have regular connection and easy communication between the referees and the volunteer manager to build this trust. The better embedded a volunteer service is with the specialist palliative care team, the better the outcomes. And the earlier the referral, the better. Don't wait until your client is nearing the end. All the research shows that the sooner you get volunteer supports in place for a family, the better the end of life and bereavement outcomes. 3, volunteers. We are all searching for connection and meaning. Volunteers are no different. Make sure your volunteers are engaged in meaningful activity. Why go to all the trouble of training them for specialist social support and then ask them to change the water in a vase? If a volunteer feels like their efforts are valued and they are part of a cohesive team working together to improve the lives of their clients, they will stay. An experienced volunteer is a better volunteer. And remember, it's not all about your services' expected outcomes. Volunteers have expected outcomes too. They are giving up their time from the goodness of their heart. They want social connection and they want to meet new people and to help others and to really feel like they're making a difference in the world. Take the time to let them know they are appreciated. So I guess now I'd like to thank you all for sitting so patiently through my presentation. I hope I provided you with some food for thought and maybe even inspired some of you to get the ball rolling on a new service of your own. I have a ton of information stuck in my brain ready to share, so fire away with your questions. Anything we can't get to today, you're welcome to get in touch another time.
Fantastic. Thank you, Kate. Such a great and succinct presentation, and definitely your passion for volunteering came through really strongly. So really lucky to have you there providing this support into the volunteer programs happening across New South Wales. Now, just a reminder, if you do have a specific question, then please do pop it in the chat, or you can come off mute and ask that question directly. If you'd like to also turn your camera on, we'd love to see you on the screen. It's a great opportunity to connect with each other as well. So feel free as well to turn your camera on if you'd like to do that. But yes, please, any questions, pop them into the chat. Actually, we'll go to Samar, who's put her hand up to ask a question. Samar.
Thank you, Kirsty and Kate. No, amazing. That's amazing job you're doing in New South Wales. Could you touch a little bit on the training? How long is it, and what are the different elements that the volunteers need to be trained for?
Well, there's several modules in our Palliative handbook. I'm going to have to grab it now. I can give you a bit of a list from the titles. 1 second. So there's 14 chapters or units: introduction to palliative care, a bit about public health, the role of volunteers, boundaries and self-care, communication skills, suffering, total pain and spirituality, cultural diversity and families in palliative care, grief and bereavement, bereavement support programs, And then there's stuff on particular settings, like in inpatient and residential settings and home and community visiting settings. There's a unit on young people or pediatric palliative care and the role of the volunteer and comfort care, and about dying. We are just about to review this handbook. It's on the list of things to do over the next few months. So we'll be coming up with a 3rd edition, and we hope to, we're inviting people to join with us and tell us what's missing so we can make sure we include anything that's not there that's important. For example, there's nothing in there about voluntary assisted dying, or there's been a big rise in biography services. So we're going to include things like that. But we'd love to hear from anyone who's got some input to add to that training. Often the services, they all do it at their own time. Sometimes they might do 2 full days, like over, a week spaced apart, or a couple of hours, a day over several weeks. They all do it differently.
Okay.
There's also all the other mandatory training, like your occupational health and safety, and safe lifting things, and, PPE stuff, and all of the other kind of basic health volunteering stuff. That's the bottom line that the palliative care knowledge comes on top of.
Thank you. I have another question, but I'll let everyone else speak first, and then I'll come back to you.
Okay, we'll come back to you, Samar. We do have just some interest in, Kate, the volunteer writing program. And I know we do have an in-person session that's coming up soon, but can you just maybe just give a bit of an overview of what that volunteer writing program is? And perhaps we could share some information to everybody after this session on some specifics as well.
About biography?
Yes.
Okay, so there's the biography volunteers are often, well, they do all the palliative care volunteering, and then they get extra training on how to do a biography. It's not a proper biography. It's more like listening to like creating a transcript of a session. So they will go, say, once a week for an hour for a 6-week session, and when they're there, they will record what the client is talking about, and they'll encourage them to, talk about important things that have happened during their life, maybe where they grew up, or about their parents, or, big moments in their life. They might want to include stuff about travel that they've done, or, mention stuff about important milestones with their children. So over these 6 sessions, the volunteer biographer will record these conversations, and basically they're not putting it into their own words. They're trying to just transcribe it so it's still in the voice of the person who's doing that. And then they go away and type it all up, and they might add photos that are relevant to whatever that topic is, and it gets nicely bound and delivered to the client at the end of the biography sessions. The main reason for it, though, is not to have that biography document. The main reason for it, it's like a dignity therapy. When you're sick and dying, like as you get sicker and sicker with a, life-limiting illness, you start to drop away all the things that make you you. Like first you're too sick to work, and then you're too sick to play sports or go to your craft group, and then you're too sick to go out with your friends, and then people might not drop around so much because you're so unwell and you need extra care. And little by little, your whole existence is chipped away until you're left with nothing but people asking if you've taken your pills today, dear. And the process of engaging with a biographer is to help people reconnect with their identities and remember who they are, and get meaning from that, help their life, remember, what it's all about. It's a powerful thing.
Yeah, it sounds really powerful. And I think you can see why it's having such a big impact, and really giving, like you were mentioning before, as a volunteer, that need to also feel that you are getting something out of that time. So I imagine those connections are really powerful for the volunteer too.
Yeah.
So another question here, which is from Charlotte, is around, for programs, how do they recruit volunteers? Do they just self-select, or is there an interview process? What's been the best approach as far as recruiting volunteers into the service?
Well, every service does it their own way, but the general sort of thing is there'll be the volunteer manager is the person doing the recruiting. So they'll either, like bigger services will have, you know, volunteer pathways on their websites and things like that, or they might put information out in their local community newspapers or on the radio, things like that, saying that they're looking for volunteers. Often it's word of mouth. A lot of the time they have more people wanting to volunteer than they have the capacity to take on at any one time. So it depends on the size of the service. Some might only recruit once a year and just do one big intake and train everyone in a chunk, and only have the time and effort, resources to do that occasionally. Others would have intake more frequently. So yeah, it depends, but essentially it's the volunteer manager who has the expertise to be able to know when they're interviewing someone. You know, you kind of have to do screening checks initially. Like, you don't want someone who's recently bereaved. You want to give them a good couple of years post bereavement, because a lot of people find that they want to give back because they've had some end of life experience around them. So we always make sure people have enough space to breathe before they try and give back. I guess it's interviewing for temperament, like sussing them out if they think they're going to fit with the role, because it is, you know, a certain kind of person to do this job. It's not for everybody. And part of the onboarding process with all the hoops you have to jump through, there's a lot of bureaucracy with vaccinations and police checks and all the rest of it. So it's lengthy. And then they start the training. So the training is for the volunteers to learn about what they need to do, but the training is also there so the volunteer manager gets to know their new cohort of volunteers. And over the weeks or days that they're spending time with them in this training, interacting, they'll get a really good feel for whether they're going to be successful in the role or not. And that's part of the benefit of having a really good volunteer manager, because they have that expertise. Did that answer the question properly? Was there something I missed?
No, I think that was a great response. And Emma's just contributing to this discussion and has just outlined that her organisation does community trainings a couple of times a year for life limiting and end-of-life literacy, with a pathway to go on to volunteering roles. So sort of defining that pathway in. So thanks for sharing that, Emma, as well. Just a comment that's coming, which I think it's important for us to recognise from Jane Ann, was thanking you for your presentation, Kate, but also really wanted to call out that their volunteer service in their area is led by Arlene Roach. And
hi, Arlene.
And that's really, Arlene's doing a fantastic job in that role, and it would seem that Arlene is that perfect example of good volunteer support services manager from that perspective.
Yes, and we have Janine as well, who's the executive supporting that volunteer service too. So the Southwestern Sydney is lucky; they've got a really big and well-supported service. It's definitely an example for the rest of us.
Yeah. Okay, that's great. We'll go back to Samar, who had another question.
Yeah, thanks. So when the trained volunteers need some help to call on some community support, whether taking people to appointments or helping them with some household chores, how do you deal with this extra support that comes from the community?
What do you mean if it's prearranged? Sorry, can you just say that again? Is the volunteers are being asked to provide extra support, or sorry, say that again?
If the volunteer decides that this particular family needs more support than this particular volunteer is able to provide, like extra support from the community to help with the practical support that these families need.
Yeah.
How do you categorize this group? I mean, let me tell you why I'm asking this question. So in the southwest of Western Australia, you may have heard about the Compassionate Connectors program, which I have presented at the Oceanic Palliative Care Conference.
Yes.
So the connectors are sort of those volunteers that you train, but then they call on the help of the community to help with all these tasks, because the connectors are really building the capacity of the community to bring in more people into these families, support networks and social networks. So we call them the caring helpers. Do you have a way of managing those, or you don't actually go that far?
Each service usually has very defined roles and boundaries for what their volunteers are allowed to do and what they're not allowed to do. And they may differ from service to service. Like some might allow, transport in cars with their clients, others might not allow that. So each service chooses their own boundaries. And a volunteer is well placed to notice whether the family they're supporting does need extra help. So the pathway for that would be for them to speak to their volunteer manager and raise these concerns and say, I really think, Joe's struggling. They could use some more help around the house. What can we offer them? The volunteer manager, ideally, who's well connected with the specialist palliative care team, will then be able to feed that back to the team, and they'll get social workers involved and things like that. Often in regional and rural areas, people know the local community services or the aged care providers if there's, packages available that might be able to be introduced. So it's the backwards and forwards between the team, the manager, the volunteer, and the family. There's like a downwards and an upwards information stream flowing, ideally. There's not, because it's so important for volunteers to be, I guess they need to be well managed for their own sort of mental safety and for debriefing and things like that. They need the support of a manager, but it's also important to maintain a duty of care and make sure that the volunteers going into anyone's home have been vetted for police checks, and they have been trained to know what the professional boundaries are. So it's kind of, I guess that raises an issue if you're just getting just a random person to come in and help. The structure system of having like a volunteer oversight through the team seems to be the way that it happens here the best. But yeah, I mean, there's often I'm sure there's times when lots of people need community support. So ideally, those services should be able to be round up with through the team.
We're just getting a comment coming in as I was actually going to either go to Janine or Arlene if they wanted to contribute to that feedback and that conversation we were just having then. So we're just talking that if Samara is meaning more compassionate communities approach to building more general social support across the community, etc., with neighbours, it's not so formalised in New South Wales yet. But Arlene or Janine, if you wanted to come off mute and contribute anything to that question, please feel free to do that.
Getting it off mute was a challenge. Sorry, everyone. Yes, Samar, in New South Wales, I think we're at the beginning of our compassionate communities journey with trying to build partnerships much more widely out in community. And here in southwestern Sydney, we're fortunate to now have a health promotion officer who is leading some of this work in our district, and particularly starting with multicultural communities. So it does happen as well through community nursing, where they will often talk to families and carers in particular about building their networks. Have you got other family members? Can they go on a roster? What other skill sets are around that contribute around the care of that person in the home environment? But we're not as sophisticated as you sound like you are in WA at this point. So something to aspire to.
Thanks, Janine.
Yeah, that's great. Thank you. So I don't think we've got any other formal questions. I guess, actually, no, Charlotte has just popped one in. So does anyone else use the Healthy End of Life Planning app information? So that's probably something that you could respond to in the chat there to Charlotte. So if anyone is using the Healthy End of Life Planning app, so certainly you can respond in the app and just to that question. Kate, I guess if thinking about, you've inspired some people to think about a program and getting it up and running, what's the first step you recommend people take? What do they do? Where do they start?
Give me a call. Give me a call. What do you need? I can point you to the resources that will help you the most based on, you know, whatever information you tell me. Our website has got all of that stuff there. Just go and have a rummage around in our resources page. There's so much stuff. If you research really, I mean, there's a lot to read, but the statewide framework's probably a good place to start. But yeah, probably easiest to give me a call and I'll see if I can point you to stuff.
Yeah, I think that definitely you are a wealth of information to be able to get people and help people get on track with that. I'm just going to check one more. Okay, so just a request to hear some success stories on attracting volunteers. So this is really good feedback, actually. Again, anything in the chat that you would like to hear more of from Palliative Care New South Wales and the volunteering program. So we will take that down. And as Kate was referring to, the Volunteer Hub, we do encourage you, if you're not already, that you can subscribe to the monthly e-news bulletin on that website. But those type of ideas or requests that you have are fantastic for us to start building content and making sure that we're sharing that type of information that's most useful to you within the service. So we'll definitely take that down as something for us to do more of in the future. And just Samar's just made a general comment there, but I think based on that, that was a really great introduction to the session. As I said, please do go onto the website and have a look at our Volunteer Hub, and do subscribe to the e-news so that you can remain up to date on that information. You'll also then be alerted to when events are coming up, such as the volunteer conference, which is sold out, unfortunately. So it's very, very popular. Kate, it is sold out. Is there any spaces available?
No.
So which is great. It's very popular, but you would then be given a heads up on those type of events that we have coming up, any professional development sessions, etc. from that perspective. And then, you know, would love you to consider, obviously, Palliative Care New South Wales. We are the peak body representing your voice. So if you're not a member of Palliative Care New South Wales, it's something you might like to consider. And we do actually have an Aboriginal and Torres Strait Islander health membership, which is a free membership. So it's a really important group that we want to work more closely and represent more. So if you do know anybody, then they are definitely eligible for a free membership. We do also offer free memberships for volunteers. So any volunteers within your service, they can join as a member, which means that they're also receiving key information from Palliative Care New South Wales, which will be more about palliative care overall in New South Wales rather than a specific to volunteer content. But there's some really great content, learning and member opportunities as part of that. So please just be aware of that. And we'd love you to promote that to your volunteers as well. So that really brings us to the conclusion of this information session. Just want to thank you so much for spending this hour with us. And we will send out some information after. You'll have Kate's details if you don't already have them as well. And finally, we just want to say thank you to all of you for what you do in palliative care. And I really hope on Saturday that as part of World Hospice and Palliative Care Day, you take a moment and you stop and reflect on your amazing contribution to a compassionate community. So we wish you the best for the rest of the day, and we hope to see you again soon. Thanks, everybody.
Thanks, everyone.
Thanks very much. It's a great session.
Thanks, Nick.